Good. So my name is Daniel Kettor. I am the Executive Director for Rainbow, and I am coming from Sierra Leone, Freetown. Rainbow Initiative is a national organization that provides holistic services for sexual and gender-based violence survivors. We have been in existence since 2014. We started as a project under International Rescue Committee, and then we transformed ourselves to be an independent organization that is visioning to end sexual and gender-based violence in West Africa, in the world, and promote equal justice for everyone. Rainbow Initiative have three main goals. One is to provide awareness raising, do prevention work, engage in awareness raising around sexual and gender-based violence, and then model our cases that we see into the Rainbow Center and put it in the form of awareness raises and inform stakeholders on earlier warning signs of sexual and gender-based violence. And the other goal area that we are working on is service provisions. We provide holistics and free confidential services for survivors of sexual and gender-based violence across the Rainbow Centers. And at the Rainbow Centers, we provide free medical treatments, we provide free psychosocial supports, and also support survivors, victims that come to the Rainbow Center to access justice. And then we refer them to different institutions such for different opportunities, such as livelihoods opportunities, education, and other areas. And then also another goal area is advocacy, influencing policy to ensure that change is systematic. And we gathered a lot of data at the Rainbow Center, when the incident occur, how it happens, and everything. We gather that data on a yearly basis. We provide this data to stakeholders to make informed decisions, and also to be able to allocate more funds for sexual and gender-based violence issues in our country, Sierra Leone. So we have been a vital partner for government. We have worked with government collaboratively. All our Rainbow Centers are located within government hospitals. Okay. Yeah, government is providing support to our services. And we also work with other partners, donors, and NGOs to ensure that we end sexual and gender-based violence. I think, like, I will speak specific in Sierra Leone, but in West Africa in general, looking at the data that is coming on, the issue of sexual and gender-based violence is alarming, especially during the COVID period in the world in general, because we saw a lot of violence occur, intimate sexual partner violence occurring during COVID period, because there were lockdowns, and perpetrators or partners and their or wives were at home, children were at home, and there were so many violence reported cases. So we saw an increase in sexual violence being reported across the continents and in our country. And so service providers were, really, really very busy, and everybody was focusing on COVID, and not looking at other areas of violence that is occurring within the home and within our communities. So as an organization, we were very vital in educating the public, in ensuring that the entire public and the entire world understand the issue of violence that is occurring during this peculiar time. Because when everybody was at home, everybody was worried, there was no food, and then, those that used to go to work were at home, lockdowns, and there were no movement. So, these, and then even they report, there were so many other reported cases at that time, because to have access to services was very difficult because of the movement, lockdowns, and other things. But as an organization, we continue to provide those services at those very difficult moments. We provide medical treatments, we provide psychosocial support, and just after, sometimes in some countries when the lockdowns were, just after the lockdown, you will see a lot of reported cases following from the lockdown, because like I said, everybody was at home, children were at home, and then the abusers were also at home with them. So we saw those cases being reported. So in Nigeria, I know, specifically in Nigeria, I know there were also similar cases. In Guinea, we had, women, going into the streets. And in so many parts of West Africa, we saw those cases coming out, being reported. As I said, it's always like that. But after the COVID period, like I said, COVID exhibited so many things. There were so many underlying things that happened during COVID period. So we saw a lot of reported cases after COVID, and a lot of people were calling for our services in my country. A lot of women coming out because we have children between the ages of 11 to 18 who that was the highest percentage that we ever had in the COVID period. We had over 1,600 cases being reported.
Children as well?
Yeah, children between these are only children. For 1 year, we had over 3,000 cases during the COVID period in 2020, 2021. We had 3,226. If you go on our website, you'll see all the number of cases that we had reported in the past few years from 2001 to 2022 or 2020, 21, and currently we are also collecting data. But as I said, a lot of people are reaching out for our services, and even the government is playing very vital role. We saw the First Lady in my country being very vital on this issue with the hands of our girls, and the President declared the state of emergency. We saw a lot of involvement, and and there has been attention. In fact, Sierra Leone has been used as an example to tackle sexual and gender-based violence in the region and in Africa as a whole. So it was, I think it was a miracle for Rainbow Initiative, because when, as I said, Sierra Leone has been used as an example to tackle sexual and gender-based violence. And there was a conference recently in Sierra Leone, 10th African Conference on sexual rights, sexual health and rights, that was organized in Sierra Leone, and AHI was a conveyor. Dr. Eze was a conveyor of that conference to host it in Sierra Leone. And with that conference, we met with various people from all over the world. They came to Sierra Leone, and then the president was there, a lot of stakeholders were there, and then we were able to have connection with AHI. Dr. Eze was there, and we had partnership, we had discussions, myself and I took him to our board meeting. He was very inspirational, he was very, very accommodating to Rainbow. So we decided to say, okay, and then we heard about what he's doing in Nigeria. So as an organization, being an indigenous organization in Sierra Leone, so we wanted also to come to Nigeria and learn from his experience, because he has been in existence since 1987, and this organization has been in existence, and we are just recently starting, in as much as we have a national coverage and national profile. But with his experience and with his profile, we wanted to come and learn and gain some experience, so that we take it back home to be able to replicate our expansion model, the growth that he has grown. How do we grow as an organization? What system should we put in place to reach to a certain level that he has reached as an organization? So the purpose of our visit is more or less a learning visit, to learn from what AHI has been doing, and then in terms of building system, in terms of expansion, in terms of growth, in terms of staff motivation. So purposely I came to Nigeria as an executive director to meet with the executive director here, and then also the program staff, the team, see some of the programs that have been, existent for a long period, and then also the massive work that you guys have been doing here. So I was blown off. So much things I have seen in just 2 days. I have learned a lot of things in terms of programming, in terms of strategic management, in terms of thinking beyond, beyond what we are having now. And as an organization, how do we also intend to grow? What kind of partnership do we go into? What kind of growth do we want to see ourselves? How do we grow without limiting ourselves and also considering the risk? And all of these discussions have been. So I consider Dr. is here as a mentor, as a father, as somebody who has inspired me so much and is ready to support at any time. So that's where I'm here, and I think I made the right choice, meeting with the staff, the teamwork, the collaboration. And one of the key things that I have learned so far is putting the issue at the center of your work. Because if you look at AHI, they are promoting youth and development. So, and I saw young people being placed at the center of development. They are here working in an office. Some of them are 15, 16, 17. I was so impressed with that. So it's something that I will take home and see how can we put survivors at the center of our work and see, in as much as we are having survivor center approach, but how can we have them work within the organization also to gain experience and continue to expand our services. Well, I think there are so many things. You are working on sexual reproductive health and rights, and we are working on sexual gender-based violence. We are experts in different fields. So I think with this experience, we can share our experience on sexual reproductive or sexual gender-based violence and why we learn from you, how you talk about sexual rights and sexual reproductive health. And I was also impressed with the clinic, within the office. These are all, how are you providing these services? And I think it's something that you can also learn to see how also, because one of the things I also was also looking at is the center being attracted to young people coming every day. It's something that, for us, because it is within the government hospital and within the government facility, and it is within the hospital, the issue of stigma and discrimination, people will just say, I'm going to the hospital. They will not say, I'm going to Rainbow Center separate, that is being built separate. So that's another thing. That's the kind of model maybe you could learn from us to see how you can be able to partner with government and then have your structure or services within the government hospitals. But this is a fantastic building that I've seen. As I told you, we have also acquired 4 acres of land recently, and then we also want to learn. One of my questions I was asking, how did we are able to fundraise to build those massive structures? And I was able to learn those things, and I will be able to implement them in the next couple of years. I think one of the fundamental things for us who want to establish on AHI and Rainbow will continue to work together, and one of the things is for us to establish an MOU, to sign an MOU, how we can collaborate on programs, experience sharing, we could send staff in AHI to come here and learn some of the work that you are doing, and then you also send some staff in Sierra Leone. We could do that kind of linkages, opportunities. We could do multi-country programming together. If we working on key issues, maybe you could have a program that's looking at sexual gender-based violence and reproductive health. We would say we have our partner in Nigeria that is ready to come and support us in the process. So these are all opportunities that we are looking forward to, and we hope these opportunities will come to pass in our lifetime, and so that we are able to support, because we are all looking at South-South cooperation, even our donors, because one of the things, we have similar donors. We have UNFPA. You guys are implementing partners of UNFPA in Nigeria, and we are implementing partners in Sierra Leone, and we hope this visit will not be end of just one-off visit. It will continue, and very soon we'll invite one staff from here to go to Sierra Leone and also be with us to help build our capacity either in system and whatsoever. So these are all ways I'm looking at us collaborating to ensure that we are able to achieve our goal as, indigenous organization that is aspiring for growth and visibility.